You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, this is a special edition, big topic. We're talking about people that are suffering with either chronic headaches, even migraine headaches, you've been told you have sleep apnea, or if you just have chronic facial pain. With us, we have a expert on the topic, literally known throughout the U.S. and outside of the U.S., and I've wanted him on the show for quite some time. His name is Dr. Steve Olmos. Dr. Olmos, welcome to the program.
Thank you for having me.
Now, I have heard about you for a long time. I'm not trying to play up to you, but I was telling you, I was interviewing this guy that's involved in TMJ. He was a dentist. Mm-hmm. And I said, I'm interviewing the king of TMJ. And I go, guess who? He goes, Dr. Olmos. I go, yes. He goes, oh, good. So again, a lot of people know who you are. So for people that don't know about your center, here in San Diego, because I know you have 65 centers spread all over the country, but here in San Diego, who's the typical patient
all
that you
over
see?
the world.
All over the world.
Excuse me.
Okay.
Yeah, we're in 7 countries.
Oh, okay.
Yeah. We're throughout the U.S., Canada, Australia, New Zealand, the U.K., UAE, Dubai, and Bahrain.
Wow. And so all of them are TMJ and sleep therapy centers of Dubai, of San Diego, of the different areas.
Yeah, that's correct.
Okay, good. So who's your typical patient that you see?
A person with an orthopedic problem. They can't open their mouth. They have some kind of dysfunction, noises, pain. Pain category is another category. Could be pain in the face, the head, headaches, neck pain, all associated pain. And then people that can't breathe. They have sleep disorders. So they'll wake up extremely fatigued, probably with a headache, and they just basically start their day off awful, and their day stays that way.
So do you see people getting better every single week in your practice, like reversals of these symptoms?
No, I see them daily.
Okay.
People, depends on what their conditions are, that we can help in numerous ways, more ways than they thought. Some people might come in because they can't open their mouth and find out that they were suffocating at night, that was the greater issue, that the locked jaw was the symptom of the problem of suffocation. Have people who coming in for disturbances of the jaw, maybe some sleep issues, and turns out that's directly related to their cardiac issues. So when we treat those problems, their cardiac problems improve. Atrial fib is a good example of that.
Okay.
It's one of the first heart symptoms with obstructive sleep apnea. So we see a lot of that, and just innumerable other issues.
Have you had people that were on CPAP, because we know that's effective,
Mm-hmm.
but they couldn't wear that CPAP for whatever reason? Have you had people that have been able to get rid of their sleep apnea without CPAP?
Well, absolutely. I'm one of them,
Okay.
and so is my wife. So, yeah, absolutely. Every day, it's. If you look at the statistics, only 40% of the people who have been prescribed CPAP actually use it more than 4 hours a night. So it isn't utilized greatly. Even when it is used, it isn't used the entire night. So there are alternatives, and there's consequences for not treating it throughout the whole night.
Okay.
And yes, absolutely, sure.
Now, let's start with migraines, of all the things, people with chronic headaches. Mm-hmm. And that's how you got your start. You were telling me in the green room that you had headaches yourself.
Right.
And then you dove into this research.
Well, actually, I was treating people for headaches.
Okay.
And I was a headache sufferer.
Okay.
And so I come to realize, the light comes on, that I'm one of these people. It is really hard because if you're treating someone for a headache problem, but you've never experienced that, it's really hard to understand how they feel. And I tell my patients, listen, I can empathize with you because I know what it feels like to be crawled up in the fetal position in a dark room, praying to pass out, because no matter how many pills you throw down your throat, it's not going to affect the issue. And I know that hopeless feeling. And I've had a lot of days that I've had to call my office and say, I just cancel all the patients
So
today.
when you first started out, let's say 30, 40 years ago or whatever, your headaches were so bad you couldn't even go to work.
Right.
Really?
Absolutely. Yeah. Yeah.
So what'd you do?
Well,
how'd you hear about it?
I changed my behavior. I treated myself like I treated my patients. I said, I got to change my diet. I can't keep eating the same thing and expect a different result.
Okay.
I got to treat my breathing problem. Okay, turns out back then I didn't know I had apnea. You wouldn't guess. I'm pretty thin, I'm pretty active, but I have apnea. And so I had to treat that. And that finally, between diet and treating my apnea, I was able to lower my blood pressure. And for the first time in my life, I was able to get off antihypertensive meds. And I've been hypertensive since I was 20.
So how do headaches have anything to do with that TMJ joint? That's my question.
Well, because the same nerves that innervate your jaw and your face and your head are the same nerves that are involved in migraine headaches, and so they're hypersensitive. They're inflamed all the time. So it doesn't take very much to push somebody like me over the edge. At least it did, because I was already inflamed because of my diet and because of my chronic vascular inflammation from suffocating all night. So I changed that. I gave myself a greater adaptive range. Now I can enjoy a glass of wine with my wife, red wine. I never could do that before.
Are your headaches almost gone?
I don't have headaches anymore. No, I don't have any
How long
headaches.
did you have them?
Oh, for all of my life.
Now, I hear of women getting headaches more than men. Have you had women that had 10 years worth of headaches, like 10 days a month, 20 days a month, and now they're gone? Has that ever happened?
Oh, yes. Oh, yes, yes, yes. But you have to change the things that produce them. And you have to restore proper function. One of the other things I had done was nasal surgery, and so that I could breathe properly, so I could use my immune system. And so if people are willing to make changes and improve function, it's basically quality of life changes. So I tell people it's what you do mostly, not what you do occasionally. Okay. So you can occasionally have a little this or that, but that's not going to throw you off the rails. It's what you do mostly that's going to determine your quality of life.
Okay, now with the sleep apnea treatment that you do, when somebody goes into you, usually it's a referral from a medical doctor, an oral surgeon, another dentist. Like how do people hear about you now? Mostly, is it referral?
All of the things you said. Yeah, so physicians, dentists, chiropractic physicians, osteopathic, you name it, all the different kinds of specialties that are aware of what we do. And word of mouth from other patients as well that have been helped. So yeah, those are all sources of referral.
Okay, now you treat things a little bit differently, and correct me if I'm wrong. So I've had look, we've had this program for 22 years. We did our first TMJ discussion about 21 years ago, and all the dentists that I talk to say, look, these people are breathing just fine during the day. Then they lay down at night, tongue drops back, jaw drops back. So what they're doing is just moving that lower jaw forward with a splint, okay? The other thing they're doing is they're opening up this airway with dental work. You say this is not just necessarily a teeth problem, that you have a different philosophy than what they're doing. Tell me about that.
Well, I think there's a greater understanding of why a person has a breathing disorder. So you talk about sleep apnea. Okay, well, some of it's structural. Some of it has to do with the length of it and the tonus of the muscles and how collapsible. And like you say, sometimes it's positional where they fall back and the tongue blocks the airway with the jaw. Okay, that's part of it. The other part is neurologic. It's also the person's response to CO2. What wakes you up from not breathing is the increase in CO2, not the decrease in oxygen. And so that wakes up your nervous system. And people respond to that differently. So the longer you've been not breathing, then it changes your response. Okay, so you can have a heightened response. They call it high loop gain. You could have a lower response. Okay, your arousal. Like how long does it take you to wake up when you're suffocating? So the longer you don't breathe, the harder that is on your system. So there's neurologic as well as structural. And that's just basic understanding of the problem. So how to treat it? You have to address all those issues. You have to address the sensitivity to CO2. You have to address giving tonus to the airway. I do it a little different.
What does that mean, tonus to the airway?
That means that's why apnea gets worse. See, whoever has apnea was born that way. But the reason why it gets identified usually later in life is because it's worsening. Okay, so the collagen in the muscles is being lost as we age, and so now the tissue becomes more floppy. It collapses at greater frequency, and then at some point they say, "Oh, they went in their sleep." Yeah. Eventually,
Okay.
systems go out. Heart attack, stroke, whatever is the ultimate cause of death. But it was the repetitive stress to the nervous system and the vascular
So
system.
how do you approach it differently than the traditional dental approach?
Well, I am using dental techniques, oral appliances, in order to manage the jaw. The tongue is important, and the nose. You have to do all of these structures on the physical part, but then you combine it with CO2 sensitivity. So nasal exercises, things like that. You kind of have to look at the whole. You have to treat the nervous system as well as the muscles and all of the pharyngeal collapse problems. You have to do it all at the same time.
So these people think they're sleeping, but they're not sleeping.
Oh,
And they wake up exhausted.
yeah. Well,
I mean, they're laying there for 8 hours, but they're not sleeping, I guess.
Well, they have interrupted sleep. See, the real problem with apnea or a breathing problem is that every time you wake up, you produce cortisol, and cortisol causes inflammation of the vascular system. So that's what changes you and predisposes you to heart attack. You get thickening of the blood. It's called oxidative stress. So every time you wake up from not breathing, but you don't come all the way awake. It's not conscious.
So mostly it's your spouse or partner that realizes you're waking up.
If they see that, that's called a witnessed apnea. But a lot of times these people have no idea because they're unconscious. They have no awareness. Okay, and so you really have to look at their health history. You have to look at the anatomy that they have, and then you have to see, well, how do you wake up? Because I ask three basic questions of all patients. Can you get to sleep? In other words, do you have primary insomnia? Are you staring at the ceiling? You can get to sleep, but I can't stay asleep. Okay, so the question is, can you get to sleep? Can you stay asleep? Do you wake rested? Okay. Oh yeah, I can hit the pillow, no problem, but I wake up every hour on the hour. I can get to sleep. I stay asleep. How do you feel when you wake up? Oh, terrible. Okay, so the quality of sleep is not good, and so that needs to be investigated.
So with the things you're doing, they can now wake up with energy. They're sleeping longer. They're not waking up every hour.
That's the
10
point.
times.
The point is to consolidate sleep. People seem to get used to waking up because it's always been that way, so they call that normal. Whatever they do, that they call that normal.
Okay.
So but that's not normal. You shouldn't wake up during sleep. If you wake up, that means that you've been disturbed from sleep. Okay, and there's consequences to that. And cardiovascular disease is one of them. That's why it's so highly linked. Okay, so people need to go to sleep, stay asleep, and wake up feeling refreshed. That's how you know you have good sleep. If you have to get up to go to the bathroom, that's a symptom of a sleep breathing problem.
Really?
Oh, absolutely.
Why?
Well, because the mechanisms, different mechanisms, but so if you have an obstruction, let's say it's obstructive apnea, where your throat and jaw are blocking your airway. So the diaphragm's trying to draw in air, but it's putting pressure on your chest. So you get all this negative pressure. So the right atrium fills with blood, the venous blood, and it tricks your body into thinking that you have too much fluid. So you produce a diuretic hormone that then now produces more urine, fills your bladder, and that's why you have to go get up.
So you have patients
I used to have to get up 3 times a night to go to the bathroom. And then once I treated my apnea, sleep the whole night through now.
Really?
And I still drink a big glass of water with my vitamins before I go to bed.
So your patients don't have to get up in the middle of the night to urinate or
Well, it
whatever?
all depends on varying
But I
degrees.
mean, you have
but
some, though,
that's the
that-
point. Oh, yes. Oh, absolutely. Yeah. I'm one of them, yeah.
Okay, let's go to migraine headaches and the Tmj joint.
Okay.
So is it TMJ or TMD? I mean, what's the difference? Give us a working definition here.
The TMJ is the actual joint itself. Excuse me, temporomandibular joint. So just like you have elbow, you have joint, okay, jaw joint. So that's not a disease process. So the D is either dysfunction or disease or whatever you want it to mean, disorder. And so it means that there's something wrong. It's either orthopedic, where the tissue between the jaws is displaced, there's arthritis, there's inflammation, it's painful, there's all these varying degrees. And then the muscles that move the jaw are going to be affected and maybe part cause of that issue as well.
Okay, so for people that are watching this with popping, clicking, they wake up with sore jaws all the time, right? They're sore.
Right.
In dentistry, and we were talking about this in the green room because I've interviewed a lot of doctors where they say it's just a bite problem. It's a teeth problem. The teeth aren't coming together properly. So when they actually maybe crown all of the teeth to this happy place that's comfortable, that you relax these muscles to mimicking normal physiology, and their headaches go away, their jaw pain goes away. And you don't agree with that it's a teeth problem.
Well, the teeth are in bone. So if you move the bones, and the only one you can move is the lower one without doing some kind of orthopedic change to the person.
Okay.
So yeah, if you move the jaw around, it's going to affect, and what you're really doing is decompressing a painful joint. Not unlike you would put a tape up a swollen ankle so that you could walk. Okay, you're giving relief of that compression. So that's what putting things in between your teeth or opening the bite or doing these things, it's basically causing this inflammation. Now, the one difference is, and I used to think this too, that, oh, because I got relief doing that for a person, that's where their teeth need to be. And then, yeah, I used to do that too. I would do orthodontically. I'd move the teeth to that position, okay? Or some people needed restorations, whatever. Everyone has different situations. But that was the thought process until I realized that it's just inflammation that we're dealing with. And so if we not only reduce the inflammation for a period of time, but address the origin, then they no longer need to have it decompressed anymore. So it's like saying, well, taping my knee or putting a cast on gives me relief, so I'm just going to leave the cast on for the rest of my life? No, that didn't seem practical to me. And now I decompress the jaw with appliances for a period of time, and in some cases day and night, in some cases just at night. But in that way, then I address the origin, get rid of the inflammation, then they don't need the decompression anymore, and they can just go back to...
So you may have like an 8 or 12-week program, and then they're over with your standard treatment.
Well, we reevaluate them periodically, but sometimes people just need an appliance at nighttime to control their usually breathing problem, and if they have changes, orthopedic changes of the jaw, to make sure they don't worsen.
You treat it like an orthopedic problem.
Well, it is
like of the joint.
It is an orthopedic problem.
Not a teeth problem, but an orthopedic problem.
Well,
it's out of what? It's out of...
Well, any jaw that makes noise is dysfunctional. Your elbow, if it made noise when you moved it, you'd go, wow, I better go get that checked, okay?
Okay.
But in the jaw, people just tend to think that that's okay. Well, it's not, okay? It's dislocation.
So it's dislocated. It's like a dislocated...
If your jaw makes noises, opening and closing, likely when your teeth are together, the jaw is out of place. It's dislocated. And when you open, it goes into place. It recaptures the disc in between. And then when you close, it goes back out of place.
Is that easily fixed?
It can be. It depends.
I mean, for some people, it's easy?
Yes. It just depends on the situation.
Have you
and the earlier you get to it, as in anything, the better the result.
I am completely healed. I used to be in pain every single day, all day. I'm completely pain-free. The headaches are gone. The sharp ear pains are gone. The jaw pain is gone. And I just cannot say enough positive things.
After my surgery, I had no more pain, and I woke up feeling well rested, and the clicking and the cracking of waking up I no longer needed to crack my jaw open, and I have no more headaches. I have no more pain in my neck, and I feel a lot better, and it's all thanks to Dr. Olmos.
My pain is significantly, almost totally gone. I don't wear a daytime appliance anymore. His method of treatment certainly worked for me.
So I came in here with a jaw problem. I could hardly even open my mouth. What I didn't realize was that I also had a sleep problem. Well, I'm now using a CPAP machine, which helps me breathe at night, and I'm very well aware now that I had a problem. And I feel so much better now that it's being taken care of. I have more energy. I don't feel foggy in the morning. I'm not sleeping as long as I did, but I'm getting a better quality of sleep. So I'm kind of glad I had a problem where I couldn't open my mouth, because I got a benefit, a secret benefit that I didn't know was going to be happening.
I'm actually completely sleeping through the night, no pain, no dizziness, no vertigo-like symptoms, and no headaches. So I can happily say that just going through everything I've gone through to just something so simple, like having a night appliance and a day appliance has been so completely worth it.
So if you can't breathe out of your nose and you have headaches, if you can't breathe out of your nose and you have popping, clicking, jaw pain, there's a connection between the two.
Oh, yes. We published, we did a paper 4 years ago, and we had, I think, 1,400 patients in that study showing that people that have fatigue when they wake up in the morning from poor sleep, and usually fatigue is very much related to nasal obstruction, that you have a 1.39 times greater risk to have jaw locking and headaches. So we see the correlation between the nose, and that's why we followed it up with this more recent study to see exactly what part of the nose might be the most related to these facial pains.
So you, in some cases, you were telling me that you connect people, your patients with TMJ problems, with a ear, nose, and throat physician, and they do this like 15-minute procedure where they help like expand the nose through ballooning or different techniques where they even kind of melt the cartilage and remold it just to open up the airway. And very little downtime, combined with what you're doing, and for many people, headaches go away, pain goes away.
Yeah.
It sounds simplistic.
Well, that's what I had. As I said, I was a migraine sufferer, and I had what we're talking about are minimally invasive procedures, that can be done in the office, in the ENT's office, and local anesthetic, and you walk out and you could breathe. That was my experience, and it was dramatic.
Could it be this easy? I asked you that you said the patients say that all the time. I mean,
I think
can it be this easy, or could it be this easy?
Well, I don't think breathing has been really given much emphasis, in medicine. Just apnea. The first treatment, the CPAP, was invented in 1981. So these are not like things that people have thought about forever.
I've had to explain. Okay. I mean, I'm going to go back to this. That there's nerves here, and those same nerves may go up the head and cause cluster headaches or different types of headaches. That if you calm those nerves with like appliance or moving the teeth around to a wider, more open bite, that the headaches go away. Well, that differs from your philosophy. To categorically just treat everything that way is, you don't like that approach.
There are certain times where teeth need to be restored because they're worn down, they're broken, so that would be a good reason to restore them, to protect them from increased damage. Is it necessary when you have pristine teeth to change them all? Well, there's easier ways to do that. There's orthodontic movement. That's an easier way to accomplish that if that was necessary. I used to do that a lot. And what I didn't know back then, because when I was doing that and I had the devices and I moved the teeth and I had everything the same, the real thing I did for those people, now that I look back at it, because they did benefit. They were better through it and afterwards. But what I realized is that I had to make the jaws wider for all the crooked teeth. Okay? And it was really the widening of the jaw, especially the upper, that increased the nasal volume. So now we have research studies that show us that for every millimeter of widening the upper jaw, it increases the volume of the nose 2.37%. So that means that for every 1% change, you get a 4-fold increase of flow through your nose. And what I was doing is I was essentially helping people breathe through their nose better, and that is what reduced their activity that was producing their facial pain. And now I realize, okay, minimally invasive techniques at the ENT and combined with what I do can accomplish the same goal without having to go through all that stuff.
Without all the moving of the teeth.
Without having to do 2 years or 3 years worth of treatment.
I mean, you have patients on your website that, they went through 5-year worth of treatment at major universities, couldn't get to the bottom of it, couldn't open their mouth very wide.
That's true.
And you said in 5 days they were able to open their mouth.
That's true.
Now, we're out of time, but for people that have the sleep apnea, they've been diagnosed, people that have, they're chronic snorers, if you could say it that way, they have migraine headaches or chronic headaches, or they just have facial pain and a lot of popping and clicking. Those are the people that you treat. So how do they get started with your program?
Absolutely. Well, you can go on our website, tmjtherapycenter.com. Center is CENTRE.
Okay.
And they can find a center close to them. And that'd be a good place to start. And there's information about the kinds of things that we can treat on the website. There's testimonials. There's a wealth of knowledge there that they can look at to see if that all applies to the situations that they're suffering from.
Now, you're in San Diego. If they go to the San Diego location, do they get to see you?
Oh, yes, absolutely, yes.
So you see all those people?
Yes.
And the medical doctors are on board with this. I mean, they're sending you patients.
Oh, absolutely. And I them. It's an interdisciplinary delivery system. It's just not what we do. It's us working with a team of people to make these people better. And that's often why they didn't get better, is one person was trying to do isolated things instead of working as a team. And that's the delivery system that we have.
So when should somebody see you? Because like you say, early detection, right? And most of us wait until we're in pain and then we go to the doctor. But if they're hearing, like popping and clicking, waking up with a sore jaw, like what are the obvious symptoms where you'd like to see them?
Those are obvious symptoms, absolutely.
Like early on?
Yeah, if your jaw makes noises, it's not proper. And it's not all about the noises, it's about what's making those noises that needs to be investigated. And usually they have no idea about the origin problem. And that's why we need to examine, that's why we need to investigate.
Like, give me a miracle story. Some of these people that have headaches for years, pain in their jaw for years, how soon could it get better?
Oh, some people, days, weeks, it depends on what their situation is. So, it varies. We routinely have people come in that have had headaches their whole life. And that
have you wiped out some of those people? I mean, their whole life they've had headaches, now they're gone?
Absolutely. Well, it's more likely we're going to affect those people than the people who come in after, let's say, age 50 and had a headache for the first time in their life. That's a whole different story. That's somebody I'm going to refer to the neurologist.
Okay.
But the ones I'm going to be able to help are the ones that have had a headache their whole life.
Okay.
Because the structural problems and the things that weren't proper have always been there.
Okay.
That's why we can help them.
And the sore jaw crowd, the people that have really sore jaws?
Yeah, absolutely.
I don't want to call it easy, but it's technically demanding, but that's an easy one you see to fix all the time.
That's what we see all the time.
Thanks for coming on the program.
Appreciate it.
And they go to the website to set up a time to see you.
Yes.
All right. Thanks for coming on the program.
Thank you.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.